Nanny from Croaky here, and I'm at the Australian Palliative Care Conference, and I'm just speaking now with Dr. Roger Hunt, who has just been on the panel for a discussion about voluntary assisted dying and its implications for the palliative care sector. But can I get you first just to introduce yourself and what your work is and how you've come to be involved in this discussion?
Sure, I'm a palliative medicine specialist. I've been working in palliative care. Came into the voluntary assisted dying debate through the influence of some of my patients, really, who were wanting their death brought forward, hastened, and some of them were seeking my help. So they need some advocacy in this debate, and I felt I needed to carry their views forward, the view of some patients. Of course, it's only a small group of patients, but some very important people in my life that I respected enormously felt that they should have better control over the ending of their life.
Can you explain the tension between palliative care and voluntary assisted death concept? Yeah. Well, what is it about?
Palliative care, hospice care has traditionally been against any active steps to end a person's life. The early leaders of the hospice movement were religiously inspired Christians who developed hospices out of the mainstream. They named them after saints and relied on church funding. They tended to overstate what they could achieve in symptom relief, in relieving suffering. They said that they could relieve all suffering, and in their expert hands, nobody needs suffer. So nobody needed voluntary euthanasia or any assisted dying. And nobody asked them, there was the claim, which was different to my experience. I think there is an element of people thinking, this is our turf, this is our professional domain, we don't need other people coming in telling us what we should and shouldn't be doing. We're in charge of this, we're the masters of this area.
There's also, though, very much in palliative care a sense of that if we did palliative care properly, how many requests would there be? Is that not a valid concern?
No, I think that's very true, and you will hear anecdotes of people who wanted a hastened demise, but then when they received good palliative care, they didn't want to die. So people do change their mind, there's no doubt about that, and that's by many palliative care practitioners attributed to good symptom control, addressing the psychological, existential, spiritual suffering that people might experience.
So you were on this panel today by dint, of course, of your background, but also particularly because you've been on the Ministerial Advisory Council in Victoria advising the recommendations for legislation there, and it does look very likely to get through and believed to be in implementation next year, I think.
Yeah, well, there was a parliamentary committee last year which came up with 49 recommendations, 48 supporting palliative care and advanced care planning, one recommendation to have voluntary assisted dying law reform, and they set up a framework for that law, but there needed to be a lot of fleshing out of that. The Minister has set up a Ministerial Advisory Panel, of which there are 7 people, I'm one of the members, to come up with a series of recommendations about how the law might work in practice. So we've put out a report at the end of July that sets out the recommendations from our deliberations. There were stakeholder meetings with the people in the Victorian community who had, particularly those who had an interest and professional involvement in this area. We debated within our group, we looked at the evidence to formulate a series of recommendations how voluntary assisted dying law may work. Now that report will be taken, it's been submitted to the Cabinet. The people who write bills for Parliament have got it. They have, I believe, drafted a bill which Cabinet will look at, and it will be presented into the floor of the Victorian Parliament for debate. I think it may happen late this month, and then hopefully there'll be some vote. If the law passes, then there will be an 18-month implementation period, a planning period where guidelines can be developed, training programs for doctors who may be involved in this, etc. So the 18-month period of planning.
So you said it was a very considered approach, particularly compared to what happened in South Australia, where a number of people on the panel sort of talked in terms of it being 1 minute to midnight and what a shock people had that it was nearly introduced here. But how do you, with the discussion that there was today, and there was clearly a lot of concern about what this means for palliative care, what did you think of, how do you characterise that debate that we saw today, and where to from here then?
The palliative care community and sector has traditionally been against reform in this area, but I think having this discussion at a national conference shows there's been some evolution and some maturity developing in the palliative care community about this. I think there is a general acceptance that somewhere, sometime, a law will be introduced into Australia, and this is a kind of preparation for handling the changes. Look, I think this whole debate is beneficial to palliative care. Palliative care wants people to talk about death and dying, to think about their own wishes, and to have discussions round the kitchen table in the pub. Dying to Talk is one of the campaigns that's supported by the palliative care community. So these conversations will be sparking up. The profile of palliative care will be incredibly boosted by this debate. The words palliative care will be spoken in Parliament like never before. They'll appear in the media like never before. It'll be on people's mind. The profile of palliative care will be greatly increased. As a result of that, and everybody in this debate thinks palliative care should have the best funding, and every patient that might consider heading down the route of voluntary assisted dying should be offered the best possible palliative care. So the funding of services, palliative services, through this debate is going to be increased.
But there were big issues raised, one around whether or not the health system is actually ready for it in terms of training staff, but also about whether there are protections, legal protections for conscientious objectors right through to unintended consequences, that kind of thing. There was a lot made in Victoria about this being the most conservative voluntary assisted dying bill in the world, I think. But do you think the Victorian legislation has addressed those concerns in the palliative care sector?
Well, I think the proposal does. I mean, the conscientious objection is very much respected, such that a doctor who is confronted by a patient who says, I want to look at voluntary assisted dying, that doctor can sort of opt out, and there's no onus on that doctor even to refer to a colleague, unlike with termination of pregnancy, where there might be some time constraints, and the law says the doctor has to refer to a colleague who may be able to help with termination of pregnancy. But in this scenario with voluntary assisted dying, there's conscientious objection and no compulsion or obligation to refer to anybody else. So I think that is clearly addressed in the proposal from the Ministerial Advisory Committee, and people should be reassured that if they don't want to be involved, they don't have to be involved.
Yet despite all that, we saw deep concern on the panel today. So do you think that's because people haven't wrestled with it, or because you actually haven't met those concerns yet?
I think they're probably not aware of the panel's report and the proposed recommendations of the Victorian panel.
And the other big question was that you talked about that you think funding will flow into palliative care as a result of this. Has the Victorian government made that commitment that it will actually really deeply fund this in a way that produces the best outcomes?
Already this year, the Health Department have committed more funds via the Minister of Health, made an announcement for more funds to go into an increase over the standard yearly increase in funding. There has been a funding boost already announced this year. I wouldn't be surprised if there are further boosts of funding. Australia has one of the best healthcare systems in the world, with universal access to health services. Palliative care services in Australia are recognised among the best in the world, but there's still room for improvement, and I think this debate will highlight those areas where improvements can be made, and they can be addressed, I hope, through this debate.
So as somebody who has, you're steeped in both sides of the argument, what do you think the palliative care sector now should do in response to this momentum?
Well, I think eventually they're going to have to accept it. If the palliative care sector were to just completely reject the idea of voluntary assisted dying, the community at large, we know that 80% of the population are in favour of legislative reform. People want to have a say. They think it's a human right to have choice at the end of their lives. If palliative care were to reject that, there's a risk of alienating the wider community.
How would that manifest though if they rejected it?
If the palliative care, how would it how would the community?
How could the palliative care sector reject it?
Oh, so they might say, we want nothing to do with this, and if somebody wants to go down this route, well, let them take that route. We don't want to have anything to do with it. I don't think that's going to happen. I think palliative, there's a duty of care, publicly funded palliative care services to provide palliative care to all patients. And if somebody's wanting to exercise a legal option, then palliative care services still need to be able to care for that person. They might say that we're not going to help you with that particular option, but we will still help you with your palliative care. And I think that's the way things are going. That Palliative Care Australia, the peak national body, has taken a neutral position with regards to law reform. However, Palliative Care Australia says voluntary assisted dying is not a part of palliative care. And in some ways having some separation there may be useful, because some people don't like palliative care services because of the stigma. Palliative care, does that mean I'm dying? And I don't really want to be involved with palliative care services, because of that connection. But then if there's also palliative care services involved with voluntary assisted dying, that might raise additional fears for some people. So at this point in time, until people become comfortable and confident that a law can be compassionate and safe, until everybody is more comfortable with it, I think having that separation of palliative care and voluntary assisted dying is not a bad thing.
Thank you very much for taking this time at the end of the day.
Thank you, Murray.